To be talking to you about the pregnancy skincare do's and don'ts. Also, as a woman of color, I'm at a higher risk of developing pigmentation and something called melasma during my pregnancy. You want to steer away from that whilst the jury's still out and whilst we're waiting for clinical evidence. We don't want to take any risks. I'm Dr. Zoya from Trick One Aesthetics in Mayfair, and today I'm going to be talking to you about the pregnancy skincare do's and don'ts. So I was pregnant last year with twins, and I found that my skin became quite dry at certain periods of my pregnancy in particular. There was a period where I felt that my skin was just super glowy and I didn't need to use anything in the world because all the hormones were doing their thing to really make my skin look amazing. But I think for myself and for a lot of women that I've spoken to, that's not something that lasts for ages and ages. It's something that, you know, comes in waves. And actually a lot of the time I found that my skin was more dry than usual. And that's because of the hormonal changes, but also personally for me, I had a lot of morning sickness, but I mean, it wasn't morning, it was morning, afternoon and evening and night sometimes too. So there was a lot of sickness, and in that vomiting, you're obviously becoming a bit more dehydrated, even though I was drinking lots of fluids, etc. So your skin obviously takes its toll with that. So I found that I really needed products that were going to really lock in moisture and hydrate my skin. So I'm going to talk to you about a few of the ingredients that you really got to have in your skincare when you're pregnant, and some of the things that you absolutely have to avoid. Remember to always consult with a healthcare professional before starting any skincare routine. So one of the first things that I really wanted to do was to lock in moisture in my skin. So this wasn't just in the way of using a good moisturizer. So that is number one. You've got to get a good moisturizer that has the right level of ceramides in it and is not comedogenic. But you also want to combine that with a hyaluronic acid serum, and always place that first before you place your moisturizer, because the serum and the hyaluronic acid will then be able to penetrate a bit deeper than the moisturizer can. And hyaluronic acid is a great topical agent to help lock in more moisture, especially when you're finding your skin's a bit more dry. So the second thing that I really wanted to make sure was in my ingredients of skincare whilst pregnant was vitamin C serum. It's not any old vitamin C serum, it's got to be the ones that are trialed and tested and have the clinical evidence behind them. So there are a few brands that have that. So vitamin C is a very clinically evidenced ingredient to show that it actually does work on your skin. So what it does is it acts as an antioxidant firstly, so protects you from the sun, protects you from environmental toxins, and works really well with your SPF as well. I really liked that the vitamin C was helping to boost collagen in my skin, and ultimately that really helped make my skin feel really nice and glowy and felt a bit more hydrated as well. And I knew that it was working with my SPF to help protect me from the sun and the environment. And the third and one of the most important things to use was SPF, and not just any old SPF, but a mineral or a physical SPF. This is because chemical SPFs tend to contain an ingredient called oxybenzone. And oxybenzone, there have been a few studies that show that it could be harmful to your babies. So you've got to make sure that you're not using that. You want to steer away from that whilst the jury's still out and whilst we're waiting for clinical evidence. We don't want to take any risks. So use the mineral SPFs. It can also sometimes cause hormonal imbalances as well. So that's one of the reasons why you've got to use an SPF, but also as a woman of color, I'm at a higher risk of developing pigmentation and something called melasma during my pregnancy. This is really hormonally driven, which happens during pregnancy, but also a lot of my pregnancy was during the summer. So also because of the summer and the sun, plus being skin of color, was the perfect cocktail of ingredients to really trigger pigmentation or hyperpigmentation and melasma. So the SPF really helped with that side of things too. So now I'm going to talk to you about the ingredients that you should absolutely not use during your pregnancy. So number one, and the most important one, is any vitamin A derivative. So this is your retinols that you can get over the counter, retinaldehydes that you can get over the counter, anything like that, avoid, but also prescription grade tretinoin. These things you must stop when you are pregnant. This is because there are studies that found that they are linked with fetal abnormalities, so can affect your baby. So definitely stop those, but do restart them once you finish breastfeeding breastfeeding, etc., because they're excellent ingredients. Number 2, you do not want to use a chemical SPF. This is because the chemical SPFs can contain that ingredient that I was discussing, oxybenzone, and generally that ingredient has been shown in some studies to affect your baby. And also it can sometimes cause a bit of hormonal imbalance too. So it's best to avoid chemical SPF. And the third thing that I would suggest avoid using during your pregnancy is a BHA, so salicylic acid. Now this can be quite tough because a lot of women do get acne during pregnancy, and salicylic acid is a really good product to use to help battle that. But you can get alternatives that will help improve the acne. And you can start using the salicylic acid again once you've finished your pregnancy. One of the reasons why it's best avoided using a BHA or salicylic acid during your pregnancy is because, again, there are some studies that find that it can affect the baby. Thank you so much for watching. If you found that useful, then let me know. And if you have any other questions, then drop a comment below. I'll put all of my skincare ingredient and product suggestions in the description below.